the houses and the tree line there behind Bridleway. So that situation should be under control during the day.
Meanwhile, an organisation called Higher Health is providing assistance to UCT students. The Higher Education Department says it's concerned about the health and mental well-being of students during this time. Higher Health's Chief Executive Officer, Dr. Ramnik Aluwalia, says a team has been sent to Cape Town to assist students and to ensure that COVID-19 protocols are adhered to.
From the Higher Health perspective, the biggest need at this moment is besides the evacuation and the hotels and the financial support that is being delivered. And I really thank to lots and lots of alumni and contributors that are from the private sector that are supporting at this moment. But the mental health and the psychosocial support is predominantly the biggest need at this moment. So, Higher Health at this moment has put a plan together with the university. We are actually dispatching a team of psychologists, clinical psychologists from other provinces to Cape Town. And as I speak to you, they are flying right now to Cape Town. We have our in-house team of clinical psychologists in Cape Town that have already moved to the evacuated sites. They will be providing one-on-one on-site debriefing and will be permanently placed around the students to help in debriefing, helping mental health needs, psychosocial assistance. We have then put up a team of volunteers, and I'm so grateful to a number of psychiatrists, a number of GPs and clinical psychologists through Higher Health have now established a team of volunteer support that every day in the evenings will be deployed towards group sessions, group counselings, group debriefings, and finding crisis management for young people at this moment. I will still advocate a number, 0800-363636. I repeat, 0800-363636. It's our toll-free mental health crisis helpline, a 24-hour service. We have redirected the traffic from the country to UCT to take every student's need at this moment. And as much as UCT's own lines are kind of overwhelmed at this moment, this additional national help goes quickly to support any student at this moment asking for requirement or help based on whether you are in the University of Cape Town or you're associated to University of Cape Town or you are in Western Cape and you are feeling enormous pressures, which is quite understandable. We really request that please use this line. There's a team of expert psychologists and counselors on 24-hour basis that are available for this support. The other support that's very much that comes to our mind is COVID-19. We are in the difficult COVID-19 times. It's not that we do not have young people who are not becoming positive across our institutions, and young people have shown affinity to the virus, which is as per the new data. So we have alerted our COVID cluster outbreak investigation team at this moment in Western Cape under the Higher Health. This investigation team is built with the Department of Health, NICD, WHO, and they are on high alert so that any time required for contact tracing, for testing program, for isolation, for quarantine, for any student who will feel symptoms of COVID-19, because in this whole running around with this whole system of being evacuated to new homes, being evacuated to the hotels, that and in the middle of a major pandemic like COVID-19, we need to ensure the COVID protocols, the COVID systems are in place. But besides that, we are working with the management, with the COVID investigation team in order to be on high alert and on standby at this moment. Trainings of resident officers, security again, for further reinstating has been in touch with the management, should there be a need. So these are all the provisions. And lastly, we are dispatching toiletries, basic toiletries in the form of sanitary pads, toilet, soaps. You're talking about brush, toothbrush, paste. Students have lost everything, and it's unbelievable. what has happened. So it's a huge devastation, and a little anybody can do at this moment will